Thank you. Madam Speaker, to the bill.
To the bill.
A small piece of this budget is Oregon Project Independence. It's funded at about 9.4, maybe $9.7 million, which is basically what it was for the last 2 years. The federal money that's coming in on Oregon Project Independence is another $5.7 million. So altogether, the Oregon Project Independence budget is $15.4 million, which should make people really happy that know the benefit that's done with OPI. Unfortunately, they don't get the full $15.4 million because the $5.7 that's federal funds is going to be taken off, moved aside, and put into this Oregon Health Oregon Health Authority budget. And why would we skim off money that could go to help the seniors and is being sent actually for that? Well, because this budget is going up $2.7 billion. That's 22% increase. Has your income gone up 22%? Do you expect it to go up 22% in the next 2 years? How about your business? Things are flourishing, right? All across Oregon, except when you look at the underemployed and unemployed. Are they going to go up 22%? No, but we are with Oregon Health Authority. Why? Why such a huge expansion of this program? Well, 2 reasons. One, because we can. The ACA Act says we can. What does ACA stand for? It's supposed to be Affordable Care Act, but it really isn't. It's Accessibility Care Act, because the ACA is increasing the accessibility to health care, which is a good thing. We like to make sure that everyone has access to health care. The challenge is when somebody gets around to who's going to pay for it. Now, it's been brought up that we're facing a budget we've kind of balanced this time, which we should, right? We have $2 billion of additional revenue in our budgets for the next 2 years over the last 2 years. It's gone up 12, 13%. We're not 22%, just all the revenue's gone up 12 or 13%. Has your income gone up? Are your expenditures going to go up by 12 or 13%? Not likely, but we are in the state of Oregon. Why? We've got this extra revenue. And if you've got it, spend it. But what happens 2 years from now? 2 years from now, we've ramped up, we've hired hundreds of more state workers because we need them to do more good with other people's money. I understand that, I get it. But in 2015, we've got to come back. And what's the new budget going to be? Well, we start where we were at, and then it only goes up from there, right? Current service level, how do you maintain what you've got? The truth is, this body, and I'm part of this body, we have made promises we cannot afford to keep. And our solution is, let's make more promises. We like covering people so much, let's expand it by 240,000 more Oregonians in the next 2 years. In fact, why don't we give subsidies up to 400% of the federal poverty level? So you've got a family of 4, they can make over $92,000 a year in income and have taxpayers making half that subsidize it. Oh, we say, no, they're not subsidizing. It's all coming from the federal government. Oh, really? Oh, the federal government, do they have the money? Well, actually, the federal government is creating out of thin air $93 billion a month. The Federal Reserve Board is buying T-bills, right? And it's called like creating it yourself. And so it's additional debt of over $1 trillion, and if billions is big, trillions is really big, over $1 trillion of additional debt being incurred by the federal government so that they can spend on programs that we can't afford to maintain. And even with all those promises, as Representative McLean has mentioned, in the 2015 budget, we have a hole of $1 billion it's already admitted. OHA in their budget, they say, you know what, it's to be determined. We don't know where that money's going to come from. But that's in 2015. And oh, by the way, in 2017, the hole is $1.5 billion. Can you imagine what this really means? Stop and think about this. Where does this end? We cannot continue to spend other people's money indiscriminately because sooner or later we run out of other people's money. Vote no on this budget. Let's get it right. Thank you.